in severe pain after mesh surgery say there's no sign of them being offered specialist treatment to alleviate their suffering. That's despite an NHS recommendation that specialist centres should be set up to help those affected. These patients have been told it doesn't include people who were given the Rectopexy procedure. Our health correspondent Matthew Hill has the story.
I can't eat. I have to keep taking tablets to stop me going to the toilet.
The mesh is starting to erode. That's going to cause a lot of problems that I really don't want to have to face.
Most of these patients were treated by Tony Dixon at Spire Private Hospital in Bristol or Southmead. It was a BBC Inside Out documentary which first exposed serious concerns about dozens of patients' lives who were left devastated after he pioneered the use of mesh to fix prolapsed bowels. Southmead have notified 203 mesh patients that they should have been offered alternative treatments before proceeding to surgery. Both hospitals continue to work through hundreds of patients to find out how many have come to harm.
So can I ask you to put your hands up if you've had a letter saying you've suffered harm as a result of your surgery? And how many of you have been offered any meaningful surgery to sort you out?
But last year they thought there was good news when a review into medical devices, including the mesh, recommended specialist centres should be set up to help them with revision surgery. They've just discovered these centres only cover pelvic mesh problems, not the procedure they had, known as Rectopexy.
NHS England and Improvement have said we will get an answer in the autumn. However, people are suffering now.
This leaves just a few surgeons trying to address their problems.
The question is how to accommodate them and in what capacity, as the funding that we currently have for the centres covers all the other meshes.
In a statement, the NHS says it's aware of the issues faced by men and women regarding Rectopexy and is working with patient groups. It says it's reviewing the most appropriate treatment for anyone affected.
Mr Dixon has previously told the BBC the operations were done in good faith and that any surgery could have complications. As the General Medical Council continues to investigate his practice, his patients can only wait and wish for some end to their suffering. Matthew Hill, BBC Points West.